Welcome to the University of Washington School of Nursing Voices of Nursing podcast, where we dive deep into the diverse and inspiring stories from the heart of healthcare. This is Voices of Nursing. Welcome, Dr. Elaine Walsh, to our podcast today. We're so glad to have you.
Thanks. It's great to be here.
We're going to have a wonderful conversation talking a little bit about you. We're going to start getting to know you a little bit first, and then we're going to go into your research more. And I think that the audience is very excited to learn a little bit more about nurse resiliency. So can you start by just telling us what your role is now at the School of Nursing? And then we're going to go a little bit into how you got to where you are now.
Sure. Yeah, I'm a faculty member in the Child, Family, and Population Health Nursing Department, and I have been here at the School of Nursing in some capacity since about 2004. So that makes me a little bit long in the tooth in terms of being here. I also have a buyout over at Seattle Children's Hospital, so I am a nurse scientist over there. My role over there is to help mentor nurses and nurse practitioners in doing research, doing evidence-based practice, quality improvement kinds of studies. So it's kind of a coach role.
And that's across multiple specialties of pediatrics. Very interesting. So what led you to Seattle Children's? What led you to your current role in faculty?
My current role in faculty, I actually was a student here, got my PhD here, and worked with a really incredible research team. It's called Reconnecting Youth, and had 4 or 5 terrific mentors who were really solid scientists. So it was not a postdoctoral role, but I felt like I got sort of a postdoc in my first job as a research scientist when I finished here. And then I just continued to work with the project and then moved over to faculty when there was an opportunity to do that. And so the teaching is really something that's very attractive to me, but I didn't want to get too far away from the clinical work as well, which was related to suicide prevention, school-based programs, looking at program evaluation as well. The Seattle Children's opportunity actually was a little bit of just a stumbled across in a situation where someone said, oh, maybe you'd be interested. And I said, well, resilience is not really my specific area at that point. And it was the mental health aspect, it of course made sense. But they apparently, I don't know if they didn't have other applicants or what it was. I'd like to think that probably wasn't the case, but that might have been the case, that it ended up just being a good fit in terms of being there. So I did the first 5 years over there on a specific funding-related project that was established in honor of one of the chief nurses who had been there for a really long time. Her name was Susan Heath. It still is Susan Heath. And she was kind of a legacy project where she wanted to do some work related to looking out for nurses. And so they turned it into a research position. And so that was 5 years of that. When that ended, I was really fortunate because the person who's in my current role over there, Dr. Karen Thomas, who is also from the School of Nursing here, she was retiring completely from that role. And so it ended up being a nice segue. So I did a little overlap for about a year and then have continued in the coaching role.
And for you, what's the coaching role really meant for your involvement? What's changed essentially?
It's picking up what's changed in terms of from the resilience work to
into the capacity that you're in now of being more of that coach and guide.
So instead of conducting the studies, I more keep an eye on helping other people. And so I've worked with people who have never done research before. They don't have any memory of a class they might have taken long ago, all the way to people who have PhDs who really just need consultation, and my job is just to kind of get out of the way. We have an intramural grant program, so nurses are able to get funding to buy out some of their time and to provide other pieces that are needed for research. And so I help them with the application process, with the budgeting process, and see them through the publication and presentation part. So it's been very fun for me.
That's wonderful. First time around for some folks, I would imagine that's intimidating.
They're scared. And I think what I've tried to do is is to meet with people so they see who I am and see that it's not, hopefully I'm not scary. And there have also been some really kind people who I've worked with who have been willing to sort of spread the word. And Karen before me did a wonderful job as well. So it was really trying, I think there's a lot of thinking about how you might work with students similarly, that they've got their own story, they've got information they can bring, and they're the expert in this particular thing. And how do I help them turn this into a project?
So there's correlation between between your role at Seattle Children's and the faculty role that you have here.
Definitely, yes. And actually, it's been really nice. I work with some DNP students across all programs, but I work with our students who are over there as well. Not all of them, but some of them, and have been really trying to hopefully open up some ideas for people about going back to school. So there are 3 people from Seattle Children's who began our PhD program this year, and I would say probably 2 of them I had a fairly decent role in nudging. One would have come anyway.
But a healthy nudge.
A healthy nudge, and really just helping people believe in themselves that, this is this very scary, intimidating place when you think about academia, even though we don't like to think of ourselves that way. Mm-hmm. But to just say, here's a person you can talk to, or yes, of course, I'm happy to write you a letter, and doing things like that just, it makes it more accessible. And then, of course, the joy is they continue on and do this fantastic work. And I just get to say at one point, I knew a little bit about their early work.
The human connection.
So important, I think, for everything. And that's what we do, I think, pretty well as nurses anyway.
It's a natural fit.
It is. And my background is for clinical areas, psych mental health. So that kind of understanding of the stress that might be involved has been a lot of the training that I had prior. So it's always helpful in the work I do.
So let's talk a little bit about that, about the work that you've been doing and the research aspects. So we've talked a little bit about how you've helped others oversee their research. Mm-hmm. So can you tell us a little bit about your work in nurse resiliency and why'd you start looking in this area? And I mean, you tell us a little bit. It was
a little bit of a stumble, a lucky stumble upon. And the work that I did. And I still continue to do some overlapping work with it over at Seattle Children's, but it's looking at what are the things that help people be resilient, what are the things that get in the way of that. There's information about burnout, obviously, in the literature, and resilience. Yes. They're not 2 sides of the same coin, but they're certainly related. And so some of the earlier work I did was really talk with nurses about, they did some survey information as well as some interviews talking about what are the things that they felt were supportive and what were maybe some obstacles, never saying, never naming names or anything, but just, what are the things that your leaders do that feel supportive? Mm-hmm. And, if they had a say in what would happen, what might they change or what might they want to advise in terms of that? So it was really a nice opportunity. And again, back to kind of my mental health skills as well, to be able to listen during those interviews and learn a lot. I think what I've been most... the last time I worked in a hospital is longer ago than I want to admit, and things have really changed in terms of the clinical responsibilities. Patients, they have more illness issues. People who normally may not have survived when I was doing that kind of work, just because the technology and the skills we didn't have. But there's such fragile individuals who are now surviving, and many of them thriving. The family issues are complicated. There's so much stress going on. So it's a hard place to work for anyone in inpatient work. I have great respect. And I think when you add the fact that these are children, it can be even more stressful. So the respect I have for how hard people work could only be compounded by talking to all these great people. But it's also a hard environment. Healthcare is tough.
Tough in general, and then when you think about what everybody's been through the past few years. Mm-hmm.
Yes.
So I imagine that you've had some ongoing conversations and dialogue and research going on related to how nurses have been able to either develop or maybe not have been able to develop as much resiliency during COVID-19 and the pandemic.
Yes.
Have you looked into that a bit?
Looked into that a little bit. Actually, I'm working on some data analysis with a nurse practitioner who did just not by accident, but I guess it was accident, pre-COVID survey about some kind of resilience pieces and also some pieces related to burnout. And then still had some grant funding, so did another survey kind of mid-COVID. And then there were some follow-up interviews. So we're working to get that written up, which is a little bit a slow process for me this week, but I'm trying to get it done. The other thing I was able to do was really do quite a bit of little brief seminars kind of to talk to people about, first of all, what we know about resilience. And one of the things that it's become this buzzword that also I think we need to be really careful that we don't use it against people and say, you know what, you're not resilient enough. That it's not about that. That resilience is really, there's so many levels of it. There's personally what we individually can do, there's what teams can do, but there's also what an organization's responsibility, and I don't mean this specific to any organization, but that they need to be able to make space for people to exercise these activities that they're providing or use these skills. And I think that the biggest piece that it comes down to, what nurses told me both pre and during COVID, was some of it is about kind of working to what we call the top of your license, being able to feel like you're doing something that you're trained to do and that others who aren't trained couldn't, rather than doing and I don't mean lower level in terms of not appropriate or demeaning or anything, but just that there are certain skills that you develop at a certain level and to be able to actually use those, and also to really think outside the box. The pressure, the staffing issues, all of those things make it difficult. And I would say the one thing between the people, the interview and the work that we did, as well as just what I read in the literature and see, is, people need to be able to take a break. Literally and figuratively be able to take a break.
Shocking.
I know.
It's just appalling. How could we have missed such a thing?
I know. Well, and I think, having been, again, it's harder than when I was a nurse, but, the idea of that you don't take your breaks, you miss your meal, you work through, you stay late, that you're a good team player. And I think we really had to switch that narrative to the fact that what we know about resilience is that you have to take care of yourself to be able to take care of other people, and that it's really not a luxury, that it really is about self-care, and that you're not going to be, the old days when I came to work sick, what a great trooper you are, no way, get out of here, stay home.
Very different now.
And we've changed that, and that, taking care of yourself is important, and that leaders need to model that too, that taking days off, that you're taking your breaks. Certainly there may be up and down days, but in general, being able to do that is so important. And it actually is connected throughout, lots of literature with making fewer mistakes, having higher patient satisfaction ratings, and having higher job satisfaction.
All of which we want to see happen in the healthcare system. And what I'm hearing you say is that the burnout, because you mentioned earlier, burnout and resilience are not necessarily opposite sides of the same coin, but there is a correlation there.
Absolutely. Yes. And there are, you can see it in the news, you can see it everywhere. There are nurses leaving the profession for good. There are also people who are leaving the more acute environments for what seems to be a less stressful, and I think probably is a less stressful environment. So what we're also doing is we're losing some of the expertise and the mentors. And we also have newer nurses who are coming in. And again, this is not about any specific organization, but that we have newer nurses who are coming in and not staying. So there's a real, how do you teach someone how to work in a really hard, fast-paced environment and also to take care of themselves? And hospitals are working on trying to have that balance.
That's so hard, because you really want people to be hopeful and excited to come into the nursing profession. Yeah. And then the expectations and the heaviness of that can what I'm hearing you say is can really turn people off in the very beginning.
Yeah, and it's generally, it can be patient care, but often it's much more about routines, rules, short staffing. Most of the nurses, when we talked about, what brings you joy, what is the most sad, it's about patience. It's about helping. It's a little bit of the, storybook that we all thought about, many of us thought about when we wanted to be nurses. I want to help people, but that it really is that, and it's not quite as simple as it sounds, but, that being able to make a change in someone's day make a change in someone's life, to empower them to be able to get better, or to help people die with dignity, or to help families grieve. That those are the pieces that bring the most satisfaction, and the things that get in the way of that so much charting, paperwork, all of the things that need to happen. That if people could just spend their time with patients, I think there'd be a lot more job satisfaction, but that's not how healthcare works.
That is very interesting to me, because when you think about the things that people verbalize about, oh, it's so hard, patients are so difficult now, and what I'm hearing you say is that patients, there's always difficult patients.
They are.
There's
sure.
always
That's why they're in the hospital.
That's why they're in the hospital.
Yeah.
People in pain, people in discomfort. There's always going to be difficult patients. But that the reward of caring for folks and seeing you having an impact balances that out. And what people are experiencing that's dramatically different from the past is more so that they're being asked to do more with less. There's more demands in terms of administrative burden, and there's that continued cultural, don't take breaks, keep working through, don't take time away, you're needed, you're critical here.
Or some of that we put on ourselves as well, that expectation that, if I take a break, my team will have to pick up for me. And what does that mean? And so it's a tough balance to do. And, I think we have to think about with families, with patients in any setting, it's potentially probably the worst moment in their lives. And so we're seeing and trying to help them. And I say we at this point, it's the royal we. It's the folks on the front lines who are needing to work with people who are under a tremendous amount of stress and are terrified often. They've lost control. We also, I am not an expert in this area, but certainly the racism throughout history that has colored how we have cared for people, how we've responded to their emotions, how we've allowed care to be accessed, all of that, fortunately, is starting to be discussed more, which is so important, but it's been going on forever, and that we are also, the lack of trust, the lack of many of the willingness to quote unquote cooperate is very reasonably rooted in not trusting a system which has not treated everyone appropriately or fairly.
And that lack of trust continues on into the experiences that nurses have.
I think it can be for the patients and families. Also, there are plenty of nurses who are not white, who can talk about experiences of discrimination and experiences of being overlooked for promotions and feeling like the only one. So I think there's that as well. We still don't have a workforce that represents the people we care for.
Yeah, absolutely. And there's been additional research done about the impact that this has had on folks who are, Black, Indigenous, people of color, people of the global majority, and they consequently seem to have increased difficulty with burnout, not feeling heard. So all of the issues that we see, just multiplied by multiple orders.
And I think we see it, in academia, we see it in nursing, we see it everywhere, that our colleagues who are people of color, who are underrepresented or under acknowledged groups, whether it's LGBTQ+, whether it's people who have non-traditional experiences. There are two things that can happen, and this is, again, just my opinion. I haven't done the research, but there are two things that can happen. One is that this person becomes sort of the go-to, the spokesperson for everything, or the students all say, this is the person I want to talk to. They get me, and it becomes this unfair burden.
True.
Or anything that's done that's not by the book becomes the person who's oppositional, as opposed to, my goodness, there might just be another way to do this. And I've learned a ton. And of course, looking back at mistakes I've made over the many years that I've been a nurse, I just feel really, I feel that it's very important for people who do have a platform to make space for people who have traditionally not. And so that's kind of where I see myself at this point in my career, is really trying to do my best to almost get out of the way, both with students and with colleagues and such, is to be able to really provide a place for them to be heard, because I've been heard a lot.
That is very wise, and also the natural evolution, right, of being someone who is curious and open-minded and makes decisions based on research. Is, you found, just as we've learned in many, folks talk in studies about how psychological safety and feeling empowered and being given an environment where you can thrive, all of those things result in better outcomes, right? Yes. And so as someone who values those things and sees that, it would make sense that you would want to apply that in your research and in your faculty.
Still have a lot to learn. We still have a long way to go, but but still working on it. And I think being able to learn from our students,
yes,
from our new nurses, there's so much wisdom, and so many, when they're willing to say, why do you do this way? And that's one of the fun things over with the work I do with the nurses who are doing research too. It may be about a specific procedure, but why do we do this? And sometimes it's because we've always done it that way. So there are several avenues, not just me, for people to be able to ask these kinds of questions and look at the evidence. And sometimes we find there really isn't good evidence, or there's counter evidence, and how might we then test that if needed, or how do we just make a change?
That's great.
So it's just so fun. I mean, it's just these young in their career people, the minds, the experiences, the way they look at the world. I start to feel a little old, but not in a bad way. Just more like, wow, I get to learn about all of this and see what things are changing over the years.
I love that, asking why, right? And when you're a student and you're learning and you're being put in a position where you're learning from people who are authority figures, right? It's great when they have that courage to ask that question, why? And like you said, sometimes you find out, oh man, maybe that's not a good enough reason for why we're doing it this way.
And I think courage is a good word, because I certainly, there are plenty of points in many of our careers, certainly mine, where that was very threatening. Someone asking me why or what, or challenging.
Yes, it's personal.
And to be able to give that up, there's a little freedom with experience and hopefully a little bit of wisdom over the years, but being able to say, you know what, I'm not sure. When as a new person teaching, it would have been very scary to me. Well, it was. Why don't you know this? And now I'm very comfortable saying, let's look, let's check. The world is not about memorizing. It's about thinking and about how to find the answers, and also learning from the people who have the lived experience, rather than us telling them what their lives should be like.
This reminds me of what you were saying earlier related to resilience, and how you don't want it to be a weaponized thing where you say you're not resilient enough, or you need to be more resilient.
Yes.
And this makes me think a little bit about what you were saying related to folks who have different lived experiences than you and different backgrounds. And so in some cases, you can learn resilience from them in a completely different life, and circumstances.
Yeah.
And it goes both ways. There's a shared mutual learning that can happen.
I mean, the opportunity that I've had as a, middle-class, white, cisgendered woman, being able to, to grow up in a family where you could go to college or not. It was a choice, and it was something that could happen if you wanted it to. Not all of us in my family chose to do that, but that, I talk to people now who the hardships, the obstacles, the real life choices they have to make, and the sacrifices to be able to get an education or to move on and to get higher education. It's a complete privilege to have been able to get my education. And so that's another piece I really feel strongly about is, how then do we try to help the next generation of scholars, of nurses, and how do we not just look for people like ourselves, but how do we really look to helping with that? And I've got a lot of growth and a lot of work to do, but that's my challenge, is to really look at, who is that person that no one noticed? Who is that person who has a little curiosity, and how do I help connect them?
The learning and the connecting never stops.
Right.
It's an ongoing thing.
And if I had tons of money, I'd love to, endow a whole bunch of scholarships. Maybe if I win the lottery.
If you win the lottery.
But for some people that really is the only way. We also have, many of our colleagues are working with students who are undocumented, and so the federal loan process is not a possibility. So what do we do? How do we help without someone digging a hole financially that they'll never get out of?
From your perspective, what do we do? We're talking to you from the perspective of being a school of nursing and working very hard to educate the next generation of nurse leaders and practitioners. So from your perspective, what does that look like?
A lot of it looks like funding. That I think that, and we're doing better. I think we've still got a long way to go. I think our interim dean, Dr. Webble, has talked about the commitment to really helping students, funding, even putting even more resources, and that was certainly our previous deans have had that kind of focus as well, but it feels like there's a little more oomph behind it. The other thing that we know is that some of our students are housing and food insecure, and how do we help? It's back to Maslow. How do we take care of those basic needs for safety, security, food, sleep? And so we do have, I know there are some funds through the School of Nursing where there's like an emergency fund that's been used for anything from, paying rent to paying for medications to keeping the internet on. But there's so much need, and there's no way that it's all being met. And so I think this is where we look to our donors who want to do something. I think anyone who's interested, and no amount is too small, and to be able to say, let me help toward this, and to be able to, I think our goal, I may be wrong, but our goal is to make sure, with anyone who's got some need, there's at least some ability to help them. But there's still going to be a gap.
And it's ongoing. It's talked about often that we have a nursing shortage in Washington State. Yeah. It's an ongoing challenge to graduate enough nurses, have enough space, have enough faculty, and it's just this constant conversation about capacity.
Or to live in Seattle. We have students who they could come here and probably pay the tuition or with funding, but they can't afford to live. So that's where we have our unhoused and food insecure students. So there's been some effort to really try to help look at that across campus as well.
And in some ways, getting more nurses and more practitioners into the workforce, it's not necessarily only that, we can't get enough people. It's that there's some folks who can't afford to. Right?
Or they can't afford to stay.
They want to. They want to be nurses. They want to graduate. Yes. They want to have impact. But then how do they get there? How do they get through the whole journey?
Yeah. And the sacrifices that people make related to family, friends, all of those pieces. There's people who are working jobs that you wouldn't normally think a nurse would be working to be able to make ends meet, and that and we are in a fairly wealthy area overall, and that's happening. Then I also feel like, well, let's look to places where there's even more poverty and more disadvantage, and this is when you think about it, it's a very wealthy country. I love baseball. This is a weird segue, but I love baseball.
Oh,
and
yeah.
You think about what one minimum wage baseball player makes, which I don't know, $400,000 a year or something, but it's astronomical.
Yeah.
And if some of these the big money people could just like adopt a class, right. It would be a drop in the bucket. I realize
nursing students.
Yeah, I realize I'm trivializing, and certainly they pay taxes on these big amounts of money, but that it would be a drop in the bucket to some people.
Right.
And it could make a huge difference.
When you think about the vast sums of, available resources that are out there, it's just getting it to the right places in many ways. And I don't think that's trivializing. I think a lot about how we as a society put our money where our values are, right? And we have a lot of value in celebrity. We have a lot of value in sports. We have a lot of value in tech, right? And then there's still those things that need to happen, though.
The basics.
The basics, those things that have to happen every day. Teachers have to teach your kids to read, and nurses have to care for your ailing relative and make sure they get home safe. Like, we aren't always as focused on those basics as I think we could be.
Yeah, and the child care issues and family care and so even, other things I think we could do to help families is providing child care. There's some models out of Stanford where thinking about kind of what a functioning healthcare workforce looks like, and it's one of the things they highlight is making sure we plan for absences and illnesses. That staffing, and I've been part of that, back when I was doing management things too. You staff what you need, and how do we say, but someone will be ill, or something will happen, or someone needs a break, and it's all financial. I know it's much, much more complicated, and it's for people much wiser than I to try to figure out, but I feel like I could still rattle some cages and say, well, but wow. The other thing that I do is I'm fortunate to be a member of the board of directors for the Lois Price Spratland Foundation. And Lois was a faculty member here, one of the pioneering advanced nurse practitioners. She's also the first woman, and I'm sure the first nurse to be a campus ombud. So quite a legacy. We work with psychiatric mental health nurse practitioner students and help try to provide scholarships for them. And between 2,000 and 2,500, what the students say about that, it is the money that helps. It's rent or it's books or it's something, but it's also the belief in them. The belief that they are a promising future leader, the belief that they can do this program. And so we've been able to award scholarships to people all over the state, which is exciting, and are trying to continue to just keep building the base and be able to do more. But that little bit, that belief in someone, especially when school is so hard. I think school has got to be, I remember it being very humbling. You were the smartest person in your class, and now you're in a class full of the smartest people.
From their classes.
And that whole, imposter syndrome that we talk about, that, someday they're going to find out that I really shouldn't have been here because I'm not smart enough, when of course they are. But we have to help with that. And those little things, noticing when someone doesn't show up for class, not in a nagging way, I try, but to say, I noticed, and you don't have to tell me your whole story, but are you okay? Do you need something? Where have you been? And I think faculty here are quite good at that. I don't think it's unique to us either, but I think that human piece, and that we move away from where, and I certainly was there too, in terms of kind of being rule bound and where's your assignment and did you miss a class and did you make it up, to saying, wow, there's a lot going on, and how do we help you get there? And what accommodation do we need to make so that you can do the best you can?
And that's shifting from this very individualized idea of resiliency, which could be penalizing, of bounce back, get over it, move on,
snap out of it,
and then moving into this more community-based model of resiliency that you're talking about, which is where people are looking out for each other, and there are systems and supports that can help people move forward even after they've had a setback.
Yeah, I think that's a really nice way to put it. And that there has to be space. You can provide massages, you can provide meditation, you can provide all these things, but if there's no place or space to use it, it's not helpful. And what we do know also about resilience is that there's different things work for different people. So for some people, going for a run would be fantastic. For others of us, we'd prefer to sit or read a book. And what we talk about with some ways to help develop or foster resilience is really finding ways to take little breaks, that you can't probably go for a run or take a nap in between your patients unless it's your lunch break. But you can take a lap around the unit, or you can take a walk around the block, or that taking these brief intentional breaks, being able to just separate from task to task to task. Not only is it better for the people who are providing the care, but it also allows us to kind of reset before we move into our next task or our next patient that we're working with too.
I think people underestimate the value of even a very short but intentional moment, just to step away.
Yeah, more work out of Stanford as well, where even 90 seconds between did make a
90
difference in
seconds.
terms of people's resilience.
No kidding.
Healthcare providers, yeah.
90 seconds.
Just resetting.
Just resetting, like being able to compartmentalize, and I felt that it was crappy. And now I'm out of that moment and moving on, and maybe not carrying it with you.
The other thing I think that's important, and we talk about it a lot, is the notion of what counts as stress, and that, of course, when there's an incident, when there's a death, when there's an error, those are all very stressful. But what about just gosh, someone was really crabby? And no, that doesn't rise to the level of a tragedy, but that it is stressful, and that we kind of need to lower the bar for what counts as support and stress. So that's part of, some of the models that a lot of hospitals use is they use huddles, they use, end of shift, or now that there's so many people coming and going at different times, end of your shift, brief checkout. And that it's just part of what's done, so that I don't have to raise my hand and say, wait, but I'm stressed. That someone's asked me, and it gives me an opportunity. And, there are days when, of course, it went well, or well enough, but that you've got that opportunity to potentially to talk with somebody about how you're doing, or that someone will notice that this wasn't a good shift. And what gets to each of us is going to be different. The whole notion of trauma-informed care, I think, that we, just like we learned how to handle every blood spill as if it could potentially be contaminated, we need to work with every single patient and our colleagues as if they've experienced trauma. Many of them have. And how do we do that in a caring way? And the biggest piece of that, the biggest problem, I'm starting to get preachy, I'm sorry, is...
this is the place. We put a mic in front of you, please, go for it.
Give me a mic. The biggest thing is it takes more time. Connecting takes more time. Checking in takes more time. Taking breaks takes more time. That means money. And how do we figure that? How do we know, because we do, that if you lose a nurse who quits after being oriented, we're into the more than $100,000 invested in a person, is it really cheaper to not bring in that extra person to cover breaks?
I'm giving you finger snaps because, yes, there's a cost somewhere, right? And it's where do you want to pay the price?
Right.
Are you going to pay the price by having turnover and having people revolving door, right? Or do you want to pay the price and be proactive and then have some semblance of continuity?
Yeah. And again, easy for me to say, I'm not a business person. I am not doing the books for hospitals or the healthcare system. And right now we know it's in dire straits. So people are hemorrhaging money. And so... But how might there be other ways to look at this? And that's where I hope my colleagues who are economists and more in that business world can really look at those things.
Intangible costs, right? That's what that's what those types of business folks like to talk about.
Yes.
Is the invisible costs.
Yes.
So they exist. It's just we need researchers and folks like yourself to look at those closely and be able to communicate about them.
And the people who leave, it's a loss on so many reasons, on so many levels, including, morale. Just, when you come in and you're working with a team of all temporary or float or, in the old days, to come in and this is my team and we all work together and, we know each other and we know each other's lives, and it does make for a smoother. Even if we don't love everyone we work with, we learn, just like a family kind of, you learn how to, so-and-so's going to be this way, or this will happen. That when everyone's a stranger or a relative stranger, it just isn't as easy. And again, it just really speaks to how hard people are working, and that the work and the care still gets done in a very good way, but at what cost?
Right. And there's an unpredictability when your team is changing all the time.
Yes.
Will you define your definition of resilience for me?
Yeah, that's a controversial.
I know, that's why I asked. Not to put you on
That
the
was
spot.
probably
How do
something you
define?
told me I could prep for, and I didn't.
I'm so sorry.
No, I think
do you define resilience?
I think it's the ability to bounce back, to weather difficult situations, and to come back from them at least at your baseline and maybe stronger. I was talking with a nurse doing some interviews, and one of the things that she described was like standing in the ocean where you're not in deep water, but the waves come in and you have to bend sometimes or flex, and then occasionally one might just knock you over. And the ability to stand back up and go back to bobbing and weaving. And
Right.
so I think it's that ability to flex with, or when you are confronted with something very difficult, the ability to see that there's a way out and some hope.
Beautiful image, by the way.
It was one of the best. I mean, it was years ago, and it was just, yes, that person really captured it.
And some days it's just going to be a little bit of a bend.
Mm-hmm.
And then other days it's going to knock you on your backside in the sand, and you have to figure out how to get back up.
Yeah.
Hopefully there will be someone nearby you who saw you fall.
Well, that's the other piece. Yeah. And who can say, you know what, I'll go stand there for a little while, or I'll stand there with you.
Or I'll give you a hand. Or
And just, I think helping each other too, that when it's really not a good day, to be able to just say, you know what, I need a lighter load, or I need a different responsibility. All those things. So those are just my musings.
your musings. They're great musings. Thank you so much, Elaine, for joining us today. Is there anything that you would like to make sure that our audience knows about or hears about from you? Healthcare's hard. I think we all know that. Anything we can do to be supportive of people's education, of their taking breaks, caring for themselves, and that's just, it always helps. And if we can do anything to support our incoming nurses, our students, whether it's with words or with money or with you've got a spare room, those are some things that people could do that would make a big difference. That's awesome. That's absolutely awesome to hear. There's practical things. It's not just this thoughts and prayers. Hope it gets better for all of you.
Yeah.
There's practical things that we can all do.
Definitely.
To contribute to the resilience of this community. Yeah. Thank you for
sharing. And nurses are amazing. I'm proud.
Oh, yeah.
I'm proud to be a nurse, and I see people who are doing incredible things that I can only dream of doing at this point, and it's impressive.
Thank you, Dr. Elaine Walsh, for joining us on our podcast today. It was a delight hearing from you about your research and also about what the average person can do to help nurses and cultivate resilience in ourselves. So thank you very much.
Thanks for having me. It was fun.
It was a pleasure.
Thank you for tuning in to University of Washington School of Nursing's Voices of Nursing podcast. Join us next time as we continue to explore topics vital to nursing, health, and well-being. Until then, stay informed, stay inspired, and stay engaged. And don't forget, follow Voices of Nursing wherever you listen to your favorite podcasts so you'll get every show as soon as it's released.